With 19 deaths in total, the outbreak at Anglicare's Newmarch house in Sydney's west is one of the country's deadliest.
And now families want answers, with some launching class action. Liz Lane's mother, Rose, is a resident at Newmarch house, and Liz joins us now. Liz, thank you so much for talking to us this morning. Your mum didn't contract the virus, but how do you feel about the way that things were handled?
Look, the whole thing was just so appalling, really. There isn't any other words for it. In the first early few weeks, the families were just scared to death. Every single time our phones rang, every time we got an email from Newmarch, it was always that question, are they ringing to tell me it's mum or dad? And the deaths just kept rising and rising and rising.
Liz, you're planning to join this class action today. What are you hoping to achieve out of it?
I think, really, we just need some changes. And unfortunately, we live in a fiscally driven world, and until it hurts somebody's back pocket, there aren't going to be the changes and reforms made that we need to see in the aged care residents.
Has there been any indication given to you by the aged care home that there will be reforms, that they're holding an inquiry into this?
I think that there's been some changes that have come about. Broad sweeping reforms, I'm not so sure. But again, the first 3 weeks, it was a completely different sort of situation to the last half of the whole situation. The changes that they made towards the end were significant, the communication and interaction with family. But I have to say, if it wasn't for the family members making a fuss and turning up outside Newmarch every day and the support of all the different media outlets that we had, we all feel that nothing would have changed. So we'll have to wait and see, I guess. I think we're all a bit sceptical that once the attention's off the residents, whether or not anything will follow through long term.
Yeah, right. I mean, the home has now been cleared of COVID, but we want to ask about how your mum is doing.
Well, my mum's not very well. Unfortunately, she has very advanced cirrhosis of the liver, which is, again, an ongoing question for me. I don't know how things have got this far before it was detected. The hospital where she's being treated is they had a lot of questions with regards to why it hadn't come up before. And given that they're supposed to have weekly visits from a GP and that there are RNs associated with the home, I'd like to know how that happened myself, to be honest.
There's a lot of questions and a lot of stress put on you and your family.
Has it taken a bit of a toll on you, too, Liz?
Yeah. I think more than anything, a lot of us just feel really guilty. It's not that we dumped our family members in the nursing home, but when they've got issues like dementia and they're too hard to care for at home, you do think you're doing the best you can for them by finding a nice home. And this has certainly been one of the nicer aged care places that I looked at. But again, there's so many unanswered questions around their health that, you can't help but feel like you've somehow let them down.
And also, you should be expected to trust the people that you're leaving a beloved family member with as they come towards the end of their lives. Liz, we're so sorry you've had to go through this. Thank you so much for your time today. Good luck.
Thank you.